Good afternoon, everyone. It is 1 o'clock Eastern Time, so we are going to get started. My name is Missy Hicks, and I am the co-founder of Wonders and Worries, and also the Director of Outreach for our Registered Provider Program. And currently, I'm the coordinator of these WonderChats, which have been so exciting and fun to present to y'all. So I'm excited for you to be here this afternoon. Welcome to those who are new. Welcome back to those who have joined us previously in this series. Just a few housekeeping things before we get started. When you enter the room, we know you're there, so you don't need to check in or anything like that. And your audio and your video is muted automatically, so no worries there. We do not use the chat feature, but we do use the question and answer feature. So if you can see that on your tab, if you have a question, go ahead and type it in there. I'll monitor those and watch them. I may interject those throughout the presentation to each of our speakers. I may hold some from the end. I might type you a response. So go ahead and use that feature. Because we have a lot of different speakers today, if there's a question you have for someone in particular, please try to type it in when they're speaking, or at least maybe put their name or the illness you have a question about so I can direct it to the right person as I monitor those. At the end, we will have the QR code, which is a link to our evaluation. Pardon me. And with the evaluation, once you complete that and submit that, an automatic bounce back comes to you with the certificate for your PDU. It does count. This one will count in the intervention domain. So you can do the QR code on the screen at the end. I'll leave that up there for a while. Or tomorrow, you will get an email that will have a link, excuse me, to the evaluation as well. So you don't have to do both, just one or the other is great. We have so appreciated all this feedback and really have taken into consideration everything y'all have been sharing and saying you'd like to hear, and has really helped shape these WonderChats for this session. Also on the evaluation, you'll see an opt-in for an email list. We're curating a list of people who just want to have more information from Wonders and Worries periodically. Won't bombard you, promise. And just to have some more information about what we might have going on or some exciting news that we have to share, future WonderChats. So just if you would like to opt into that, certainly we would welcome you to do so. And at the end of the session, the recorded session and any resources that our amazing speakers talk about will be uploaded to our website. So take a look back there. We'll have a resource sheet for you. We'll have the transcript of the Q&A. So definitely take a look at that. And it usually is posted by the weekend. So you can go back to our website for that part. So what's next? We've been doing these WonderChats, and I have loved being able to see your names come across my screen all these weeks. So like I mentioned, we've taken the evaluation data and really synthesized it and tried to see what we could do to support the profession the best way we can, especially during this time. So next week, we will offer our final WonderChat at this time, and it will be on program development. We got some feedback that y'all are interested in Wonders and Worries as an organization, and of course, we love to talk about it and tell everyone about it. But we also wanted to create something that will be helpful to you in your practice as well, and also would be PDU eligible. So next week, we'll be talking about how do you take values that you have as an organization or as a clinician, and then match your program development with that. We'll use the Wonders and Worries program as a backdrop for that talk. So I hope you'll join us. That will be PDU eligible in the professional responsibility domain. So that might be something you're interested in. After next week, we'll take a pause. Hopefully, a lot of you are gearing up and getting ready for the ACLP virtual conference. So we're going to take a pause from these for that time. And then you will hear from us about how we're going to roll this out in the future, like what our next steps will be. So that's the housekeeping update for you. I'm going to switch gears here for a second now and talk to you about our speakers for today. So our topic is illness education, every day and these days. We know things are changing for everyone. And we heard from the evaluations that you really love hearing from clinicians, the language they use, the materials they use, and really have enjoyed or appreciated that kind of content. So we pulled a lot of our clinicians together to be able to share this with you. Some of these illnesses are more adult focused, because that is our primary population at Wonders and Worries. But I hope that you can take either the information and bank it in the back of your brain for future use, or take whatever pieces are most helpful to your practice and use it in whatever way you can. So our speakers for today are Corinne Barnacle. She is a child life specialist at Wonders and Worries. Cindy Fitzpatrick, she is also a child life specialist at Wonders and Worries. If anyone was on before, you've seen Cindy on our webinars before. Kim Fryer is our clinical program director at Wonders and Worries. Michelle Martin is a child life specialist at Wonders and Worries. Shani Thornton, we are excited to have with us and welcome her. She is, you all probably know her as Child Life Mommy. She has a multifaceted private practice that she delivers lots of amazing services through. And we are also thrilled that she is a registered Wonders and Worries provider. So she is part of our partner team as well. So we welcome Shani. And then we have Crystal Wilkins, who is our operational program director at Wonders and Worries. So I hope that you will enjoy today's topic. And I would like to pass it to Cindy.
Okay, good throw. Okay. So, my part, I'm going to be talking about COVID-19 and some of the supplies that, well, first of all, anytime I do illness education, I like to use board, and of course, being a child life specialist, some props, of course, a mask, gloves, maybe even a handkerchief, because maybe the children are using these. So I would start out doing the education by asking the child what they know. And you can use the whiteboard, or you can use the whiteboard if you're doing a virtual session. So I usually start the session asking them again, what do you know about COVID-19? What have you heard about it? And then write it on your board. Because, it's been about 2 months and most of the children have heard something. Now, I'm going to share a couple of slides. And in your education with the children, I think there's some key words that you need to define. One is coronavirus. What is coronavirus? It's another name for COVID-19. You might even explain what COVID-19 means. CO means, it stands for corona, VI stands for virus, and then D for disease, and 2019. But to simplify the definitions, coronavirus, a family of germs that's very contagious and spreads among people through their nose, mouth, and eyes. And I'm going to move this. And of course, you want to use pictures. If you're doing a session in person with a child, provide pictures for them to see it. If you're doing virtual sessions, then you can still include pictures the way I have included pictures on this slide, or you can share your screen and show pictures. The second word to define is pandemic, because the kids probably have been hearing this word. Pandemic, people all over the world are getting sick with this illness. And then the third word to make sure and define is social distancing, a way to prevent the spread of a contagious disease by maintaining a physical distance between people, reducing the number of times people come into close contact with each other. And you can show them a picture, and 6 feet, meaning there's literally 6 feet, probably adult feet, in between two people to prevent the disease to spread. Okay, now you probably have seen lots of great resources, videos, there's books, and one that several of us have been using is this teaching video. It's more appropriate for younger kids, but I'm going to go ahead and show it to you now. think I'm going to start it over so I can have a full screen. Okay, sorry about that. Okay, I'm going to try again. Okay, I think it's showing it now.
Cindy, I don't think we can hear it.
Can hear?
Through the nose, the mouth.
Now we can, yes.
Roof just could get sick. Luckily, our body knows how to protect itself. Special cells battle against viruses and try to get rid of them. These cells make up your immune system. There are many types of coronavirus. This time, a new family member popped up. Because of this, our immune system does not know how to get rid of it. And that's why a lot of people are sick. Some people just get a little bit sick, like us children, for example. But even if we don't get sick, we do carry around viruses, which can jump inside other adults, like our parents, grandparents, or teachers. That's why we close the schools. Since there are no medicines or vaccines, for now, the only way to stop the virus is to stop it from jumping from one person to the other. If someone sneezes or coughs, the virus travels through the air in droplets that can stick to door handles. If you touch one and then put your hands near your nose or mouth or rub your eyes, poof, the virus gets in. So, rule number 1, the golden rule: wash your hands often and well. When I wash mine, I sing happy birthday twice. Also super important, when you sneeze, sneeze into your elbow. And no fingers in your nose. No. Keep a distance of at least 1 meter from other people. But the thing that works best is staying at home for at least a while. Like this, the virus will be so bored and go away.
Okay. So, you know, as I said before, there's lots of great teaching videos, and there's also lots of great books. But what I liked about this video, it really simplifies, you know, what coronavirus is about. And, you know, just this past week, I was working with a 5-year-old, And we were talking about feelings, and he shared that he was feeling worried. And he said it was because of that corona thing. And so, you know, the kids are hearing different things, but this video, I think, really does a good job of simplifying it. And another good book is, well, and there's also great books. And let's see if I can do it now. Okay, great book is called I Have Questions About Coronavirus. And you can have the real book that you're showing to the children or use it as an ebook. And in the virtual sessions that we're doing, I'm preferring to use the ebooks because it becomes more clear to the children because it's actually on their screen. And this book, which is on the resource list that we're providing for everybody, it also includes a part of the book where it has more pictures and less text for children that need it. And there's also a Spanish version too. Now, so, you know, in the teaching session, using a teaching video or a book, but then I would say at the end of the session, you know, to end the session being hopeful and positive, you know, I would mention that, you know, things are going to open up soon. You know, adults are going to start going to work, back to work. You are going to start going back to school. And, but right now, you know, what are a couple of things that you're doing for fun? You know, maybe with your brothers and sisters or with your family. And then either in that same session or in a follow-up session, to review the illness education, you know, there's COVID bingo. There's also a Loteria COVID bingo, COVID-19 bingo for the Spanish-speaking children. And then, or you can create questions about COVID-19 and use them to play with the game. You know, Uno, cards, dice, pickup sticks, which is becoming one of my favorite games because the children haven't played it before. So again, you know, doing an activity is a part of the session to review the illness education. And now I'm gonna, now it's Shani's turn, so I'm gonna throw the ball to you.
Great. Thank you, Cynthia. Shani, before you get started, I just want to share that I know there might have been a little bit of crackling in the video. That link will come in the resource list. So just so you know that you guys tomorrow or whenever you pick up the resource list, you can click on that and re-listen to that if you'd like to. Okay, thanks, Shani.
No problem. Okay, hi guys. So thank you so much. I am going to be providing you guys with information on advanced stage cancer with a terminal prognosis. So I've done this both in person as well as virtual. Obviously in person is brings it to another level, but it works virtually and it's just as powerful and therapeutic. So before I meet with the kids, I always have that conversation with the caregivers first. If I'm able to speak with a loved one that is dying, and if they have caregivers around them, can also support that conversation about what their children already know, what they've expressed and talked about cancer, have they explained that their treatment's no longer working, and that they are dying. What information has already been shared. If the person who is dying is not able to have that conversation with me, then it's another caring adult that's been taking care of the kids that I communicate with. So gathering already the information of what's been told, what the children are expressing as well. Have they been asking verbally, you know, is mommy and daddy, or mommy or daddy gonna get better? You know, they're seeing maybe a hospice nurse come in and provide medication. So are they thinking that they're gonna get better from that? Or have they asked, you know, are they dying? So once I gather that information, then I have that conversation with the caring adults about you know, how they can provide the correct information about that their loved one is no longer going to get better and that they are dying. And I kind of coach them along with the language and talk about how it's really important to, you know, provide concrete information, simple information that the child at whatever age level they are, that they'll be able to understand, and honest information, and that it's okay to use those words, dying. I also let them know, because if they're a little fearful and they want me to take on that role, I kind of reiterate the importance of them doing it, and that I can help them along with it. But their children know the caring adult and they don't know me. And so it's a very pivotal time in their life. So this conversation will probably be one that they will forever remember. And once I kind of clarify that and help them along, then they're pretty confident about what to do. So then once that's all done and we've kind of set that foundation, then I meet with the kids. And I talk to them about, you know, do you know why your loved one is ill? Do you know what's causing it? I've had them draw pictures. Sometimes they've been able to tell me what cancer is and verbalize it. Other times they haven't been able to really articulate it. So we'll talk about that. And what I begin to do is kind of explain that there's a lot of different types of cancer, but the cancer that their loved one has, what it is, that specific cancer. And then I talk about how our bodies are made of billions and billions of cells. And I ask them if they've ever heard that word before, a cell. And oftentimes kids can be like, oh yeah, blood cells. We kind of connect it to that. And then I show images. So for example, here's an image, like a little piece of paper, just like a screenshot of something I found on Google. And it's just different types of cells. So we talk about how our body's made of these cells, and they all have really important jobs to make sure that we're healthy and strong and we're functioning. And then I also use Legos or blocks. So I can explain, like, let's talk about different types of cells. So maybe this cell is cells for our bones. This cell could be cells for our hair. Oh my gosh. This is a cell for making your blood. And I try to have the kids kind of connect and find out if, I'm so sorry, I'm in my husband's office. I'm going to see if I can just hang that. Okay, sorry, virtual connection there. Anyway, so we talk about the cells, and then I talk about how cancer is also a cell, but it's not a cell that's supposed to be in our body, right? And how that cell is blocking and making those healthy cells not work and function. And the type of cancer that their loved one has is an advanced cancer, that the treatments, and we talk about chemotherapy, radiation, and surgery, the types of treatments that their loved one's been through is no longer working, and that the cancer cells are multiplying. They're spreading throughout their body, and it's making that their healthy cells no longer work. So what is happening is that their loved one is dying. And I actually use the words because I want to make sure that they can hear it from a caring adult too and know that it's okay. And sometimes even in that conversation, I'll say it's, you know, it's okay to use that word. I then go into talking about the medication that they probably are seeing their loved one get, which is medication to provide comfort and, for pain management. So we talk about how their loved one might have like a PICC line, and so I can show it on there. And sometimes they may have a port. And so we talk about what those are, and that they're little straws within their body that are providing a really quick way to get medicine instead of drinking it, because they need a lot of that medicine to make sure that their body is not in pain. And I kind of manipulate it virtually. I show them this way if I was, with face-to-face, and I would let them, explore and play it. But I'm very clear that that type of medicine is not going to make their loved one get better, that their loved one is still dying and they will die, but it's going to make it so that their body is not in so much pain. I also educate them on what they might see and feel, that they might see their loved one get a little bit thinner, that they're not able to eat and drink as much, that their loved one's hands and feet might be a little bit more cold, that their loved one might be really sleepy. And sometimes that pain medicine will make them very, very tired. So they're not going to be able to have energy to have a lot of conversations. They're not going to be able to get up and play. It kind of depends on where they are with that active dying stage. And I just kind of support them through all of that. And then from there, I move it and transition into a therapeutic legacy building activity. So I am going to now pass it to Corinne. Are you ready, Corinne? Here we go.
Ready.
Woo! Did you get it?
Thanks, Annie.
No problem.
Great. Hi, everyone. I am Corinne, and I'm going to piggyback a little bit off of what Shani was talking about. So Wonders and Worries is actually involved with a research study with the UT School of Social Work with learning how to figure out the impact of advanced cancers with our families, so stage 4. So Wonders and Worries has our core curriculum that we use with families, but we've adapted some of the activities to kind of help explain other things. So I'm going to be sharing you our recipe for blood soup, but to talk about immunotherapy and how we make a visual for kids. So the first thing that I'm going to show you is I'm going to attempt to show you a video. And this is kind of the first thing we start off with, because visuals, as we all know, are really helpful for kids, especially when science is involved. Animations are great. So I'm going to show you this video that is from the Children's Hospital of Philadelphia, and it is a wonderful tool for us to kind of start with.
I'm going to explain how immunotherapy works. We turn your T cells into supercells that can find and destroy cancer cells. Let's take a look. T cells, a type of white blood cell, are designed to kill disease cells. But cancerous B cells often look like your own normal healthy cells, so T cells don't go after them. We're learning how to change that. We collect millions of T cells from the patient. Then we reprogram them in a lab so that they can now identify the B cells and grab onto a substance that is found only on the surface of B cells. When we put the reprogrammed T cells back into the patient, they flow throughout the body and begin locating cancerous B cells. As the reprogrammed T cells attach to and destroy the rapidly dividing cancerous B cells, they also multiply in the body, and they can remain in the body long after to continue fighting any lingering cancerous B cells.
Great, so that is a wonderful visual, and I want to just segue into the things that you will need material-wise to do this activity. So you will need snack-size Ziploc bags or sandwich size, depending on how much plasma you want to put in your blood soup. You will need red hots to signify red blood cells. And then the really cool part about the immunotherapy, this is how we've adapted it. You'll need regular size marshmallows and then the miniature size. So think about the ones when you do a hot chocolate packet and they're little and tiny. Those are the ones we're talking about, and they come in kind of a container. You'll need rice to signify platelets, nerds for cancer cells, corn syrup for your plasma, and a piece of paper to make a blank flip book. So what we do, okay, so I'll kind of just start talking with kids, kind of like Cindy said, prompting them and kind of figuring out what they know. And we talk about the blood cells and how we know red blood cells carry oxygen and energy. And then our white blood cells, our T cells, they fight off infection for us, and they're the soldiers of our body. So what I have kids do is they take their Ziploc, and I've already created them for us today, and they'll put the plasma in, and they really enjoy that. And so we just talk about how, the T cells, like the video, are harvested from their parent's body. And then in the lab, they're regenerated and given a really special protein to make them super cells. And then those supercells are put back into their parent's body. And what they do is they, are able to find the cancer cells and attack them and kill them. So how we do that is you put your plasma in, you allow the kiddo to, at first, put the red blood cells in, and we kind of prompt and say, has your parent been feeling tired? Have they been sleeping a lot? Like, how many do you think there needs to be in here? And they kind of get to put as many as they want. And then this is where we do the white blood cells. And these are the little ones, and I have an example. They come in this little bit like this. And so we talk about how this is how their parents looked. And then after we get to do that, after the immunotherapy happens, then they become supercells, which are the big marshmallows. So what I really enjoy about this activity is it breaks up a lot of the learning because they get to take breaks and put things in here. And it's a really good sensory toy. So what I've been finding lately virtually is that a lot of kids, after we do this, and we're still talking about their parents' cancer, they're able to kind of move it around and play with it. And they really enjoy that, and it gives them something like a coping tool to use. So you can use snack size bags or bigger bags. It doesn't matter. It just depends on how much plasma that you have. Corn syrup. I've even have had kids lately been putting them a face mask like this, and it actually feels really good and is calming and cool. And some adaptations that we've made due to virtual stuff and maybe parents not having these supplies on hand. Some parents, it's not as cool, but we've been using olive oil as the plasma instead of corn syrup if they don't have it. You can use any type of like pinto beans or, macaroni, whatever you can, and maybe kind of create your own hybrid of what the cells might want to look like. So this is just a really great hands-on activity, and then it kind of turns pink after you get to manipulate it a lot. Yeah, so there you go. This is how we teach kids about immunotherapy with blood soup, and yeah, enjoy. So now I'm going to actually pass it to Michelle. Michelle, are you ready?
I'm ready.
Okay.
Hi, everyone. Thanks for joining us today. I'm going to talk about strokes and true to form for a child life specialist, starting with gathering some information about what has happened for the patient. There are basically 3 different types of stroke. So starting with what specifically has happened to the parent is a good place to begin. And then, of course, following up with the child and finding out from them what it is that they understand. But essentially, a stroke occurs when there is a loss of blood flow to the brain. I talk about how our blood carries oxygen and nutrients throughout our body, including the brain. So when there's a loss of blood flow, loss of oxygen, then the cells of the brain can be damaged and actually can die. And it can cause some big side effects. So one of the things I also like to do is show a brain map. Let me show you what I typically use, because they can then, technology, then they can talk about what it is that has happened to their own parent. But with a brain map, they can actually see, sorry, I gotta move this, the annotation thing's in my way. There it is. They can actually see what area of the parent's brain has been affected, and then along with what the brain is responsible for. So, if the clot is in the frontal lobe, then, emotion and decision making and organization and even memory can be affected. So it's helpful to understand from the child the differences that they've seen in their parent. So blood clots occur from one clot, that's an ischemic stroke. Many of the children that I work with understand that our blood needs to clot. So spending some time exploring that and giving them that basic understanding of when we get a cut, our platelets begin to work. They clot our blood on purpose, cover that wound and keep us from bleeding. A clot in a brain stroke is a buildup of those clots. It blocks the flow of blood, and then that's where the damage comes. There's these words, hemorrhagic blood clots, hemorrhagic strokes. Those are brain bleeds. And then there's also something called a mini stroke, which is similar to a blood clot type stroke, but many times it goes unnoticed and can have some long-lasting effects, but typically it's a stroke that resolves itself almost automatically. Strokes can happen across the ages. Typically it happens for someone over age 55. Sadly, it can even happen to babies in utero, so across the ages. At Wonders and Worries, the families that I've seen, it's been dads. They've been in their 30s and their 40s, so many times those clotting type strokes are caused from high blood pressure or unresolved blood diseases, injuries and trauma. The hemorrhagic strokes, those are traumatic actually. I'm sorry, not always the clots, but one of the things in ischemic strokes that we might see working with children is that it can be a result from obstructed sleep apnea as well. So that might be something to consider. It's diagnosed through blood tests and any one of those imaging types of MRI, CT, CAT scan, so having the opportunity to talk through how it was diagnosed. It's important to react to these things quickly and receive some type of treatment quickly. So depending on what the parent has gone through or what type of stroke they have, they may have had surgery. They almost always have rehab of some sort. Can be inpatient, can be outpatient. I want to show you a video that I use when I'm working with a client at Wonders and Worries. It's not very long. I like to point out to the children that the narrator actually has an English accent, which can be fun, but she also says the word petrol, so that can kind of throw children off if they're not thinking about what that means if they've never heard it before. So let me show you this short little video.
What is a stroke? A stroke is when something goes wrong inside our brain. Your brain is inside your head. It is the really clever part of your body. It helps you to think, talk, move, and jump. Your brain controls everything you do, a bit like a car's engine. Different parts of the brain do different things. The brain has two sides, and they control the opposite side of your body. For example, if you lift your left arm, the right side of your brain is making it happen. You can see and feel your brain working all the time when you wiggle your fingers, blow a kiss, point your toes, or even sing a song. The brain needs oxygen and energy to work well, a bit like how a garden needs water. Your brain gets energy from your blood, which is pumped up from your heart. It goes up to the brain through tubes called arteries and veins. They are a bit like a network of roads leading up to a big city, your brain. So, what is a stroke? There might be a blockage or a leak in the tubes leading to your brain. If this happens, your brain is not getting enough blood and it won't get enough energy or oxygen. When this happens, you have a stroke, a bit like if a car engine cannot get enough petrol. The part of your brain that is not getting enough energy and oxygen will find it hard to work. If it is the talking part of your brain, it may be hard to get the words out. If it is the moving part of your brain, it may be hard to move your arm or leg.
I like that little video because it follows up with the medical education piece, but gives a little bit more, and it obviously is quite visual. Oh, sorry. I don't know if you can hear that, but it's still playing. I'm going to turn it off real quick.
5-year-old from Blount County continues his journey to recovery.
Let's see. So I always want to explore with the child the changes that they've seen in their parent. Many times it's speech related, many times it's physical changes, like having trouble using their hands and arms and walking, and what it's been like for them seeing those changes in their parent. I want to share one activity that I do. Some of the equipment is taking Model Magic. So these are white Model Magic. In the picture, there's actually 2 packets of the white, and you only need a little bit of the red to form the blood clot. If you want to color this, Model Magic does accept food coloring. If you want to make it look like gray matter, then just take 1 part red, 1 part blue, 1 part yellow. Wear gloves, and once you incorporate the color into the Model Magic, it will stay there and it won't continue to come off, but you really have to wear gloves when you get started. Other things are IV tubing, if you have it. Maybe even a nasal cannula. If you use a nasal cannula, or if the child's doing this at home, if they have a straw, then you just have to have the option to pinch it. At home, they can use Play-Doh. It doesn't have to be Model Magic. Other things I like to use for the medical equipment, just desensitization, is a medicine cup. You'll need a syringe. I use some water and red food coloring. In the picture I'm about to show, the food coloring in the cup looks red, but when we transferred it to the IV tubing, it looks kind of orange. So you might experiment with that. I didn't do that. It worked well with a 9-year-old that I used this with. So we would just went through it, went with it rather. So I'm going to share the pictures of the activity so you can see what it is you actually do with those supplies. Oops, not brain map. Sorry. There it is. Okay, so we worked on just a paper plate. This is after the fact. So she created the shape of a brain using that Model Magic. It was 2 packets. And then she created that red circle where the clot was in her father's brain. I use the IV tubing. There's also the syringe with the colored water to simulate the blood. The tubing was placed all the way through to the clots. And the nice thing about IV tubing, of course, is it has that built-in clamp. That was placed purposefully where the clot is to show where the blood flow stopped. She was able to push the syringe through, the coloring, liquid water coloring went through. We talked about her father's surgery, how they removed the clot. And then I had her physically remove the clot herself. And that's what it looks like after. Some of that red Model Magic sticks. I opened the clamp on the IV tubing, and then she had the opportunity to push the rest of the simulated blood through, and we talked about how blood flow has resumed. So it was pretty effective, and she enjoyed it. So I thank you for your attention, and I'm going to pass it on to Kim. Kim, are you ready?
I'm ready.
All right, here it comes. Woo!
I thought I'd try a big ball. Get my exercise in. Hello, everybody. So I am going to talk about ALS, or Lou Gehrig's disease. Some of you may be more familiar with that title. So ALS stands for, and kind of the words like Michelle was saying, some of these words are tough, amyotrophic lateral sclerosis. So I often tell children, you can also just say ALS. You don't have to be able to pronounce those big words. But children may have heard it called Lou Gehrig's disease, and that's because a famous baseball player by the name of Lou Gehrig had ALS. So ALS, we'll just talk about initially what ALS is. ALS is a progressive neurodegenerative disease that affects nerve cells, the nerve cells in the brain and the spinal cord. So I'll talk about that motor neurons. ALS specifically affects the motor neurons in the body. And motor neurons are a nerve cell, and they form part of that pathway along along which impulses pass. So when signals are sent from the brain or the spinal cord out to the muscles, the motor neurons are the pathway along which those impulses or those signals are sent. One of the things that I find can be helpful, especially with older elementary and then middle tweens and teens, is just helping them kind of differentiate between motor neurons and sensory neurons, where motor neurons are those neurons that that help send the signals from the brain and spinal cord out to our muscles, to our hands, to our feet, to our voice, to our throat. But our sensory neurons are those neurons that take the information from the environment and send that information to our brain so that we can make sense of that. So I'm going to share my screen and show you a couple of things. I want to show you this picture. This is from the ALS Association, and we'll be sharing this website with you. But the activity that I'm going to describe is essentially creating a motor neuron, and I'll show you that in just a minute. But it can be helpful to show a child this picture over right here, where it shows a healthy motor neuron and then a motor neuron that has been destroyed or damaged by ALS. And these motor neurons are kind of at that end point of the cycle where they're communicating with the muscle, but the motor neurons are working throughout from the brain, spinal cord to the muscles. So just this quick infographic can be helpful. And then I'm going to shift and show you, sorry, I have to get to the right spot. Where is it? Oh, right here. Sorry, well, fumbling just a bit today with technology, but that's the way it goes sometimes. Okay, let me show you a picture of what we create with beads, and then I'm going to kind of break it down into supplies. And I want to just send a shout out, a thank you to Neuroscience for Kids. This actually came directly from their website, this picture that you're looking at right here with a motor neuron made out of beads. But these other pictures kind of break down the supplies that you can use or a child can use. Pipe cleaners, different colors of beads. They don't have to be any specific colors. Children can choose which colors. And then shorter sections of pipe cleaners, and then all put together to create what really kind of looks like a flower, but to create a motor neuron. So let me stop sharing my screen and show you what that looks like. So here's a motor neuron that I created. And of course, right now, if children don't have all of these supplies at home, one thing they can do is draw, or you can help them draw the motor neuron and then label. And even if they have created one out of beads, labeling the different parts of the motor neuron, the cell body. So the dendrites, they kind of are stimulated and they start the signal. And the cell body then says, oh, this is the message that I want to send through the axon and then out through the synaptic terminal and then to the next motor neuron, to the next motor neuron. So creating a motor neuron obviously can be a wonderful, just tactile way for a child to be doing something while you're talking a little bit more about ALS, and certainly talking about what they're understanding about how ALS is impacting their loved one and what parts of their body it's affecting. So then the other piece of this would be the activity that we would do in person, and then I'm going to talk about how you can adapt it, is to take a string of beads. It could be on a pipe cleaner, and usually this is a much longer string in person, but I made it short for the purposes of this. And just think about a message, so kind of like the telephone game, where you can think about a message and have the child maybe think about an activity that they would do, like putting on their shoes or going, pouring themselves a bowl of cereal. And so then you have all these, so here's your motor neuron, it's sending the message, and then you can do kind of like telephone, like you need to, I just dropped my motor neuron, you need to get your sock out of the drawer, and then put your sock on your foot, and then put your foot in your shoe, start tying your shoe. And so if you were in a group, you could have a long string, and each bead could kind of represent a message, like in the telephone game. And then what you can do is you can tie a knot in the string. You can also use Play-Doh or something else to just kind of block the string. But then you can show, like, so now we're going to say we're going to make a bowl of cereal. So then let's get our bowl, and let's get the box of cereal, and open the box of cereal, and then pour the box of cereal, and oh, this message got stuck and couldn't go through because that motor neuron was damaged. So you get the idea of how that can work and be a lot of fun. Another adaptation for virtual and just a fun game to play in person or virtual is Simon Says. And this can certainly be done through the virtual platform, where one of you is kind of the brain sending the messages and the other is the muscles. And so you can play it just like normal Simon Says. Stand on, Simon says stand on your left foot. Simon says hop. Simon says hop in a circle. And then you can add just ways that the message is garbled. So maybe you're covering your mouth and it's harder to hear. Or maybe you're saying the message from off the screen like this, and it's harder for the child to kind of decipher what it is. So there's obviously a lot of different ways where you can make it a little bit more challenging. So those are some ideas around helping children understand. Let me pick up my motor neuron, understand ALS, and just experience what what it can be like when motor neurons are not functioning properly. So now I am going to pass it to Crystal. Crystal, are you ready?
I'm ready.
Okay, here it comes.
Got it. I love that you dropped your motor neuron, Kim. That's hilarious. Hi, everybody. So my activity that I'm going to be talking about today is illness jeopardy. I'm going to specifically talk about it in relationship to, renal disease. And, but it's super adaptable to any kind of illness. So regardless of what medical population you work with, or what illness a particular family has that's receiving service from you, you can adapt this really easily to lots of different types of illnesses. And so what I do, this is, again, illness jeopardy. If you think about jeopardy, there's the different categories that a kid could ask from, and then different point levels. And so if you can see over here, I put it on my bed, but I have different categories of questions. So way over there, I have renal disease basics and transplant. And then in the middle, I have hemodialysis. And then over here, I have peritoneal dialysis. And so kids can choose the category that they want to and the point level that they want to. You can see if they're super competitive or if they really just want to be able to answer a question. And so they're going to choose the easier one. But then it's just the question answer game. I find that it's best for probably older school age or teenagers, because they do have to have some sort of understanding of the illness before you get started. Otherwise, it's really frustrating to be able to just not know all the answers. But for those older kids who've had pretty robust conversations with their parents beforehand, or just know a lot of information already, it can allow you, it can allow them to be able to share what they know, which can give them a sense of competency, but it can also allow you as the child life specialist to assess if there's any misconceptions or confusion related to the illness itself, the treatment, or some of the changes that they might be experiencing within their family. And so I'll give you a couple examples. So I'm going to choose hemodialysis for 100. And that says a hemodialysis catheter is placed in what part of the body, which is typically the chest, sometimes the neck, but typically the chest. And then I'm going to choose peritoneal dialysis for 150. It says true or false. Most peritoneal dialysis patients do their treatment while they sleep. And that's true. Peritoneal dialysis usually takes about 8 to 10 hours. And so usually the most time efficient way to do that is while they're sleeping. And so I've drafted a bunch of questions that are going to be sent out in the resources that we send you specific to renal disease. I've also included one on cancer. And then I've also included one on just feelings and coping. And so the great thing about this is literally a poster board. and sticky notes, so super cheap, cost-wise, and Sharpies or regular markers are fine too. And then I love this for virtual sessions. This is actually a session or an activity I did with a kiddo, two teens, I guess a year and a half ago or something, before COVID, that I had worked with this particular family who the mom was sick. She had cancer, was on hospice when I met them. And I worked with them for about 4 weeks before the death was experienced. And then the parents were divorced. And so dad lived up in Philadelphia. And so after I worked with them for those first 4 weeks, and then after the funeral, they moved to Philadelphia with their dad. And so you can imagine all the changes that they were experiencing. And they were really feeling unsettled and wanted to continue support, but we didn't really have a platform for that at the time. And so I was like, well, we can continue support as a family. If I was doing virtual support, I only really felt comfortable doing that if dad was present. And I felt like that might be helpful anyways for what the family was experiencing. And so we did family sessions virtually for a few weeks until they got connected to a bereavement center there in Philadelphia. But it allowed me to continue support with them, and we focused a lot we did illness education with it, but we also just did a lot of feelings and coping and getting used to a new city, getting used to living with dad again, because we hadn't lived with dad since they were little. And so you can really adapt it to be whatever the categories need to be, they can be that. And I do like to, when I'm doing the 3 categories, I like to have kind of the illness ed, the treatment ed, and then a feelings category as well, because then the kids can dial in and out of the things that are more fact-based, and then also talk about their feelings related to that illness as well. So I'm going to stop there because I know we're just really close to time. I'll pass it back to Missy.
Great, thank you all. So what we're hoping today to do was just provide you with some mini bits. I feel like there were mini bites of information related to illness education activities each of these staff members do on a regular basis, and really wanted to share with you some of our thoughts about how we carry that out. There have not been a lot of questions that have come through, but I guess I wanted to just see if there is, well, there is actually one just came through, I'm sorry. So it says, thanks for this question. It says, for the bereavement activity with cancer and the ALS activity, where is this support being provided? CCLSs aren't in adult hospitals, right? And I'll just take that last part, and then I'll let Kim or Crystal address the first part of your question. But, you know, as I've been getting feedback from these sessions that we've been doing, you know, at Wonders and Worries, we've been working with children of adult patients in a community setting since 2001 when Meredith and I first founded it. So we've been doing that in a community setting. But as I've been working through these webinars, I've been getting emails, and, you know, I'm loving hearing that there's not a lot, but more and more people are employing child life specialists to either take consults or cover in an adult institution. And so I enjoy hearing that and thinking about how our role is growing and it's being perceived as important in that adult world. So it's happening more and more, Amelia, so stay tuned. Kim, do you want to take that?
Yes, I mean, I'll just kind of add to what you're saying, Missy. So with Wonders and Worries, it is in a community setting where we're providing this. So we have offices where children and parents can come, but we can do all of these things, and we have been doing all of these things over the phone and then now virtually with children. So if we can't meet with them in person, we can guide parents in the education piece, give them the tools and the language, give them activity ideas. But then, of course, when we can, provide the activities face-to-face. And in some settings, our setting being one of those, we can go to a child, so we could meet them at the hospital or the clinic. Sometimes we do go to the home, but we usually just go to home sessions if it is an end-of-life situation, or if it's a specific like family session that we're doing in the home. Yeah, so hopefully that helps answer your question.
Great, thank you, Kim. And Kelly just shared that she's a CCLS in a hospice setting, providing support to pediatrics and adults in their home. There's also a group of CCLSs in adult hospitals in Dallas-Fort Worth. hopefully more and more will start to establish programs. 100% agree, Kelly. And yeah, I think that the program out of Baylor, they do adult palliative care and home visits. And I think as over time, we'll hopefully see that kind of model grow and grow. And, you know, and there's been some interest too about connecting on a sort of a more formalized level with Wonders and Worries at some point, being able to even establish research opportunities between other institutions and Wonders and Worries. So we do offer that registered Wonders and Worries provider program, which in June, I'm going to do some informational sessions about that. So stay tuned if you have any interest in that. Would love to talk to anyone about that, or you can email me directly sooner versus later. But yes, I agree. I'm anxious to see how this can grow, this area of our field. So it looks like we're at 2 o'clock. I am going to switch the slide to the QR code. You know, if you point your camera at it, it will take you directly to the link for our evaluation, as I mentioned earlier. I would like to really thank our speakers, our bite-sized information speakers for today. I really appreciate it. I know that I especially enjoy hearing people talk about how they deliver it and some of the language they use. It always helps like my brain to start thinking. So thank you all so very much. I will leave this up so you can use the QR code. And if there's some more questions coming through, we might type the answers and I can post that in the transcript over the weekend. Many thanks to y'all. Have a good week, and hopefully we'll see many of you next Friday for our final Wonder Chat before our pause. Thanks for joining us. Have a good weekend.